How you doing? My name is Trevor Davis, and this is my lower limb assessment. This is my patient, Tracy.
What's up?
So today we're going to focus on his lower extremity. We're going to focus on his feet, his knees, and his hips. First off, I'm going to ask him to lift up his shirt. We want to see if he has any rotation within his hips. Everything seems leveled, so we don't got to worry about that. We're going to go down to his knees. We want to see if he has any knock knee within his knees. So I'm going to ask him to put both his feet together. Now, if his knees was to touch before his ankles touch, that would indicate that he has knock knee. But since the fact that his knees did not touch before his ankles, then he's okay. Also, I'm going to ask him to stand on one leg. Now, the average person is supposed to stand on one leg for at least 5 minutes. And as you can see, he's fairly balanced and everything is cool. Now, I'm going to ask him to do a single leg squat. As you can see, he's a little bit off balance and a little bit of internal rotation. Can you do it one more time for me? That one was a little bit more better, but it's still, you can tell that he's a little bit more wobbly and stuff. So now next we're going to do the calf length test. Now with the calf length test, I want him to place his feet 5 centimeters away from the wall. And I want him to try to put his knee against the wall. Now, if his knee cannot touch the wall, that would indicate lack of the soleus length. And if his heel comes up off the floor, that would indicate gastromenius, the lack of the gastromenius length. But as you can see, his knee is firmly touching the wall and his heel is not coming off the floor, so that indicates a positive calf test. Now we're going to do the supine assessment. So I'm going to ask him to lay on the table for me. Now the first test we're going to do is the bridge test. And the bridge test is to, we're looking for a weakness of the hips and weakness of the glutes. So I'm going to ask him to put his feet together, put your hands on the table, and I want you to thrust up your pelvis, down. Okay, one more. Any pain?
Sure.
Okay, cool. Now the second test we're going to do is, we're going to pull his ankles together. We're going to do the ankle malleola. Now I want to see if his legs are evenly distributed and his legs are, evenly put together. Any pain?
Sure.
Okay. Now the third test we're going to do, we're going to palpate his asius. Okay, palpate his asius. Any pain, any tenderness? Now we're going to palpate his pubic bone. Any pain? Okay, now the next thing we're going to do is we're going to do the 90-90 test. So I'm going to ask him to place one knee on the table and place one knee up in a 90-degree angle. Then I'm going to ask you to lift your leg all the way up. Now the average person doing the 90-90 test is supposed to have at least 70 to 90 degrees flexion. And as you can see, he barely has a little bit. You see he has some problems with his, keeping his legs straight up. But he has enough to say that he has the 70-degree angle. Next, I'm going to ask you to place your leg down, both your legs down on the table, and relax. Now we're going to do the quadrant test. Now with the quadrant test, I'm looking for a click and a pop. Now a click and a pop indicates a labral tear. No click and a pop. Now, if it was pain, the pain would indicate impingement. Any pain? Okay, relax. Now we're going to palpate his abductors and his psoas. So, I'm going to get up on the table. I'm going to place his leg on mine. And I'm going to palpate his adductors. Any tenderness? Any pain? And I'm going to palpate his psoas. Any tenderness? Any pain? No tenderness or pain? Okay. Now, if he had any tenderness, the tenderness would indicate that the body is not happy with the load that's being placed on it. But since he has no tenderness, then he's okay. Now, the next thing we're going to do is the knee exam. So first off, we're going to see if he can hyperextend his knee. Okay, he can hyperextend his knee. Now, if he can't hyperextend his knee, that would indicate that he can't walk. So he has to be able to hyperextend his knee in order to be able to walk. Now, we're going to see if he has any movement within his patella we want to see that his patella is able to move at least 2 centimeters in either direction. Any pain or tenderness? Okay, we're good. Now we're going to do the valgus test, which this is the test for the MCL. Now we want to test to see if the MCL is intact. Any pain or tenderness? Okay. Now the next thing we're going to do is we're going to do the Lockness test, and this test is to check to see that the ACL is intact. Any pain or tenderness? Okay, as we can see, his ACL is in fact intact. Now we're going to do the McMurray test. Now with the McMurray test, we're looking to see, we're checking for his meniscus and see if there is any clicking or popping. No click or pop. That means he has a positive McMurray test. Now the next thing we're going to do is the straight leg raise. Okay. So you want to place your hand on his ankle and place your left hand on the top of his knee, and you just want to raise it straight up as far as possible that it can go before you feel any pain. Any pain or tenderness? No. Okay. All right. Now the next test we're going to do is the sideline assessment. So I'm going to ask him to turn over to his side, and we're going to palpate his greater trochanter. Any tenderness? Nope. Tenderness? As I said, tenderness will indicate that the body is not happy with the load that's being placed on it. And since he has no tenderness, that means he's fine. Now the next test we're going to do is the PGM test. And this test is to test the strength of the glutes. So I'm going to ask you to roll over a little bit. Bend your knee, lift it up. Now I'm going to let your knee go. I'm going to let your leg go, and I want you to be able to hold this position. And as you can see, he's dropping, which indicates the weakness of the glutes. I'm going to try one more time. Drop it. Let it go. As you can see, he cannot hold the position, so that indicates weakness of the glutes. Next, we're going to do the Ober test. Now, with the Ober test, we want to test the length of the ITB. So we want to try to have his knee touch the table. His knee cannot touch the table. His knee cannot touch the table, which indicates the tightness of the ITB. His ITB is too tight. So now we're going to do the prone test. So I'm going to ask him to turn over on his stomach. Now we're going to do the Eli test. And this test is to see that his heel, see if his heel can touch his glutes. If his heel cannot touch his glutes, that would indicate that his quads are too tight. And see, as we see, his heel cannot touch his glutes, which indicates that his quads are just too tight. Now we're going to do the passive straight leg raise. Now I'm going to place 2 fingers on his hamstring and one on his 2 fingers on his glutes, and we're going to see which one fires first. Either his glutes or his hamstring, or his hamstring or his glutes. Now, if his hamstring fires before his glutes, that means it's abnormal. So we're going to see. So palpate. As we see his hamstring fire before his glutes, which indicates abnormal. Try one more time. Okay, this time his glutes fire before his hamstring, which is normal. One more time. Okay, this time his glutes fire before his hamstring, which is normal. This will conclude my lower limb extremity test, and I thank you.